are a clinical researcher at Ampath, the academic model providing access to healthcare, in Kenya, in a pediatric HIV clinic. The clinic runs well and provides great patient care to families. A physician approaches you and mentions that while reviewing medical charts, it appears that HIV care guidelines are routinely missed during patient visits. They ask you to help establish a process for ensuring that providers are following care guidelines in the clinical practice. Specifically, that any overdue care guidelines are addressed at the patient's next visit, and these can include ordering clinical tests on time or a prescription refill at the end of the month. Having recent training in behavioral economics, you realize that there might be a behavioral change that could be altered through the use of an effective nudge. Although the information that the physician provided is helpful, you need to observe the clinic during a busy day to get a better sense of potential behaviors that might be contributing to the scenario. You arrive at the clinic in the morning. At the staff meeting, the physician verbally reminds all members of the practice to check for any overdue care recommendations and to address them with the patient during their visit. Shortly after the meeting ends, you notice that the nurse begins to print a large amount of papers while at his nursing station. He then begins to sort through the papers and set them into smaller piles. The nurse mentions to you that these are patient summaries for the day, for the day's scheduled appointments. The summaries contain patient information as well as any overdue care guidelines for each patient. The nurse then stacks the piles of patient summaries and gives them to the appropriate physician before the day begins. You notice that the physician takes the stack of printed patient summaries from the nurse, quickly flips through the stack, and slides the papers into her folder. She then proceeds to get a glass of water before the first patient arrives. While the physician is away, you see the nurse reviewing the patient's file on a laptop computer at his nursing station. The first patient arrives. You follow the physician into the first patient's room. The physician begins to review the patient's chart and then proceeds to examine the patient. You notice that she immediately refers to her laptop to enter in information into the patient's chart, but does not open the file folder with the patient's printed care recommendations. The visit ends, and you notice that the physician addresses the patient's needs, but did not reference the patient's care recommendation printout. You observe that 1 out of 8 times, the physician does not refer to the printed handout of the patient's care recommendations or complete the overdue care guidelines. Now that you have completed a day of observations, it is time to diagnose the behavior.